Hey, this is Dr. Story. Cross-fiber friction massage. What is it and how do we use it? Cross-fiber friction massage is a type of massage technique. And what this is for ligaments, muscles, and tendons. The majority of the time, I am treating muscles and tendons with this. Sometimes we'll treat ligaments like in the ankle or wrist, but I'm going to show you exactly how it's done. And you could literally do this to any joint in the body that has tendons, ligaments, and muscles, which are all of them. So I'm going to show you how to do this, for example, in the elbow. So the elbow, there are muscles in the elbow, numerous muscles. Now the goal is to try to figure out what muscle is the problem. And let's say it's an extensor carpi radialis brevis, which is the most common problem in the elbow where people get like a tennis elbow. Well, the fibers run in this direction. So what you would do is you would take your finger and go across the tendon and go across it 90 degrees. And how this works is you take your finger and you go right onto the tendon where you can feel the damage to occur. And what I do is I take my middle finger and support my other finger. Then what we do is we go across the fibers. Now you don't want to rub the skin because that'll irritate the skin. So in other words, you press down and the skin moves with the motion. So hopefully you can see this, that it goes across. So my finger never moves from the actual position of the skin. So I'm actually moving the skin across the damaged tendon. Now what happens is you would do this procedure for about 5 minutes. That's what I've found is the majority of the time that the patient can tolerate. Now in the first minute, what I'm expecting the patient to say is something to the effect of, "Oh man, that hurts." After about 60 seconds of doing this to a person, very often you'll get this numb feeling where the pain is actually going down and it just kind of feels numb, like I'm rubbing the area. Once the patient says that to me, depending on the age of the patient, I will either stay with that pressure or I will push a little harder to get deep into that tendon. If you were doing it on the hand, and people get a lot of problems with the tendons of their hand, if I take my thumb and do this, you see that tendon right there, that rope? So if I go to an area where there's a problem, I support my finger and I would simply go across the tendon, again, not rubbing the skin at all. The contact area on the skin, again, should be on the finger and it should never move. You should not have any type of red marks like you did an Indian burn, for example. So cross-friction tendon massage is extremely useful for a number of things. Ankle sprains, tendonitis of all the tendons of the ankle, like Achilles tendonitis, patellar tendonitis, hip flexor tendonitis. You've got the nuchal ligament on the back of the neck that it works for. Also, cross-friction massage works wonders for a supraspinatus tendon or a rotator cuff tendon. That's the one in your shoulder. Infraspinatus tendons, I do a lot of cross-friction on patients with this. Elbows, wrists, it's almost everywhere. I've even done it on the jaw with patients that have TMJ and they get headaches on the side of their head. So cross-friction massage is a technique that's specific to certain types of problems, and it's extremely beneficial. So if you found this video useful, give me a thumbs up, subscribe to my channel, and if you have any specific questions in regard to cross-friction massage, leave them in the comment section below, and I'd be happy to answer them. Thanks for watching.